Do you think you would recognize the signs of a stroke? Experts call it a brain attack, and it remains one of the top causes of death and disability in this country. But many times doctors can intervene and greatly limit the damage if people recognize the stroke signs. Here's the latest in this week's Positively Healthy. Stroke is caused by an interruption of blood flow to the brain, most often the result of a clot breaking off and traveling to the brain, where it can lodge and clog an artery. When that happens, oxygen carried within blood is cut off. In just 3 to 4 minutes, cells begin to die.
Once that vessel occludes, all of the brain tissue being fed downstream is compromised. The central area will actually die very quickly.
The more time elapses, the more brain cells die, about 2 million a minute. As this happens, the symptoms of a stroke become apparent.
Many times patients will recognize they're having difficulty getting words out, or difficulty with an arm, a leg, or just with their thought process.
Dr. Hunter Brown is board certified in emergency medicine. Patients presenting in the ER are quickly assessed and treated to stem the damage. Both of Physicians Regional Hospitals are designated as primary stroke centers.
As a primary stroke center, our goal is to administer thrombolytic medications within 90 minutes of arrival in properly selected patients. So our goal with thrombolytic medication is to restore blood flow and saving that surrounding tissue.
In order to get timely treatment, it's imperative to recognize the stroke signs.
When patients are concerned about stroke, think F.A.S.T. Is there any facial asymmetry? Is there any arm weakness? Is there any difficulty with speech? If so, it's time to call 911.
Given the potential consequences, people should maintain a low threshold for seeking help.
Especially if they have risk factors. If they're diabetics, patients with hypertension, and high cholesterol, or a family history of stroke.
When it comes to your brain, it's worth playing it smart.